This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
I'm Colby Smith. I'm Chief Resident for the UAMS Physical Medicine and Rehab Department here in Little Rock, Arkansas. And Dr. Vo made this awesome PowerPoint to kind of highlight our program for y'all. So we just wanted to thank the PM&R Scholars for having us here. I really appreciate y'all putting this on. It's really great to see so many applicants out there, and this thing, it just seems to get larger every year. I think this is my second year doing it, and so we're really glad to be a part of this. So this is our current resident crew. So seeing at the top left, these are our interns. They just got here. I like this little raising the bar photo they got here. This is the current PGY4s on the top right. In the bottom right, we have our current PGY2s. And in the bottom left, we have our PGY3s, who I guess never took a group photo. One could not be found. So instead, we've got their individual headshots. But we've got a great group of residents. We take 4 per year, and that gives us 16 total, and we are categorical. So the intern year, we'll get into a little more of that, and then our PGY2 through 4 year. So our faculty. So here we have a very diverse faculty, and our faculty is currently growing. We've had some recent, retirements, and some people move. So we're actively hiring, but these are our current faculty. We've got up on the top is kind of our adult faculty, including the bottom 2 on the left, and then our children's faculty are on the bottom right. Got Dr. Kevin Means, Dr. Ronnie Gardner, Tori Hunton, Saint Adioba, Dr. Thomas Kaiser, Dr. Mitchell Pham, Dr. Laura Hobart Porter, and Dr. Vicky Steffens. Our administrative staff. So currently our chair is Dr. Lowry Barnes. He's our interim chair. Dr. Means has been the chair at UAMS since the early 90s. And he's decided, that he'd like to spend some more time with family and take a step back. So right now he's just doing his clinic and kind of scaling his practice back as he's in his late 60s. So Dr. Lowry Barnes is our interim chair as we're searching for our permanent chair. We have Dr. Ronnie Gardner, as I mentioned earlier. She's our residency program director, and she has been PD for over 10 years. And then Dr. Tamara Chun is our program coordinator, or not doctor. Wow, sorry, guys. So our rehab curriculum. This is our PGY1. So our emphasis on the PGY1 group is to just get a general idea of medicine. So that way, when you get into your PGY2 through 4 years, you can really hit the ground running and start focusing on the rehab. So I know y'all all can read, but we'll just give you a brief overview. So we do our rotations in cardiology, because that's a common rehab complaint, emergency medicine. We do 3 months of medicine wards, a month of geriatrics, which includes time at a SNF. That's something our residents really wanted. It's something that I don't think we get a ton of exposure to in rehab residency in general, but that is a big part of rehab. So we were able to kind of sneak it into our intern year with the VA, a month of neurology, a month of orthopedics. We work very closely with the orthopedic department here at UAMS. Our current chair is our interim chair is the head of the orthopedic department. They are kind of our brother sister program. So we do a month with their clinics, a month at BRI, which is our main inpatient rehab facility. We do a month of pediatric wards, which is going to be like the inpatient peds, and that is general and specialty. It just kind of depends on the availability. We try to give everyone an exposure to both at some point. Rheumatology, that's a really great intern rotation we were able to get. We're able to do a lot of joint injections, which is awesome to get exposure to that as an intern. We do a month of radiology. The ability to read images is really important. For PM&R, our patients are going to have trauma, so we want to be able to have a good understanding of that radiology. And then we have continuity clinics and didactics. All right, so for the meat and potatoes of PM&R, our PGY 2 through 4 curriculum is going to be split into 4 different 3-month rotational blocks. So I know different programs do it differently. Ours does it every 3 months. You'll go to a new rotation. We do a minimum of 12 months inpatient and 12 months outpatient. Some residents can do more. Like, for instance, I want to do inpatient. I've signed to do an inpatient gig, so I'm doing extra inpatient. Not everyone likes that choice, but because I want to do extra inpatient, my co-residents get to do extra outpatient, which is some of their interests. We do UAMS outpatient rotations and consults. We have at Arkansas Children's, we have both an inpatient rotation and an outpatient rotation. So one of the kind of unique things about our program is we do 6 months of pediatrics. So if pediatrics is of an interest of you, you'll get to do 3 months kind of focusing on the inpatient aspect of that, which is inpatient peds as well as consults. We have a very robust consulting service at Children's. PM&R is very involved over there. And then our outpatient clinic at Arkansas Children's, because we serve the entire state of Arkansas, it's a very busy clinic. So you get 3 months exposure to those clinics as well. And even if you're not interested in peds, especially in the clinic, those patients do grow up and you'll follow them throughout their adult medicine as well. So I think that's a really great exposure. And a lot of those clinics are multidisciplinary. So you work very closely with your neurology partners, orthopedic partners, urology, other specialties as well. Then you'll do 3 months each of stroke, TBI, spinal cord, and general rehab. So you'll get exposure to all of those. We have 3 months of EMGs, where for 3 months straight, you were doing EMGs. So you will definitely get your numbers and you will be very well trained in EMG. And then we do a combined rotation between the VA and UAMS, our core hospital, where we do interventional procedures like interventional pain. So I've mentioned all these hospitals. So our namesake UAMS is where we do the bulk of our outpatient clinics. So as you can see here on this top picture, we just built a new hospital. It is called TOSH, the Orthopedic and Spine Hospital. I can't believe they made the a part of the acronym, but yep, it is called TOSH. It's super nice, brand new, one of the nicest facilities I've ever been in. And they have really great food for the residents as well. And that's where we'll do a lot of our clinics. We do our, follow-up clinics, our spasticity clinics, amputee clinics, the bulk of our clinic exposure. We do EMGs there, some EMGs there as well. And we do injections. And then we have a BRI, we have a wheelchair clinic. A lot of our UAMS patients will go back and forth between. We have our interventional pain clinic is part-time at UAMS. And we do all of our we run the consulting service for rehab at UAMS. Just kind of a side note, we also do have some private practice docs who do like regenerative medicine and interventional pain as well. So UAMS does not have its own dedicated rehab facility. So we do our inpatient rehab at Baptist Health Rehabilitation Institute, which is just down the street. They've had an agreement with UAMS for going on 40 years or something like that now, where we are partnered. We're all UAMS physicians. We just work at the Baptist Rehab Hospital. This is Arkansas's largest rehab hospital. It's the most comprehensive rehab facility in the state, and it's the only facility in the entire state of Arkansas that's certified in brain injury, spinal cord injury, and amputee, that's CARF accredited. And the reason this is a big deal is because, even though Little Rock is a smaller town in the scheme of things, I mean, the population is about 250,000. The state of Arkansas is almost 3 million, and we draw from the entire state of Arkansas. If anyone in the state of Arkansas has a brain injury that is even remotely significant, they're coming to Baptist Rehab. If they have a spinal cord injury, they're coming to Baptist Rehab. So even though you're in a small town, you're drawing from a very large area to get your patient population, so you can see a good exposure of different varieties of these conditions. So at Children's, we do a mixture of outpatient and inpatient. So our outpatient is mainly the habilitation clinic. We do spasticity management and Botox clinic in the pediatric setting. I just mentioned those multidisciplinary clinics. We do have community outreach clinics. So like I was saying, we draw from the state of Arkansas, and especially with children, it's really difficult for some of these families to drive 2.5 to 3 hours for their Botox. So the attendings and some of the APRNs have outreach clinics that go to other areas of the state. And as residents, you have the opportunity to go to those clinics if you want to. You're required to go to one, but I went to multiple just because I'm from a small town around here, and I really like that part of medicine. So you can go to the different areas and be a little closer to some of these families to treat them there. Our inpatient unit, it's currently it's a 12-bed unit, and they're kind of undergoing some transitions right now. So to be determined exactly how that's going to work out. Right now, PM&R is consulting, and hospitalists are primary. The benefit of that is you get to kind of focus on the rehab, and you don't have to take call. But it is a little different, and we're still kind of trying to work out exactly how we're going to do that. So that the VA is another one of our sites. This is where we'll do some of our inpatient rotations as an intern. You'll do your cardiology, the Jerry, med wards. And as an outpatient, this is where you'll do a lot of your procedures. So our PGY3 is kind of our VA procedure year, and this is where we'll do a lot of our EMGs. And then this is also where we'll do our split rotation for pain and procedures, where you'll spend 2 days at the VA and 3 days at UAMS. One of the benefits for being at the VA is because they pay part of your salary. You do not have to take any call for 6 months of your third year. You are just straight free, no call and no weekends. So thank the United States government and the VA for that. Another kind of interesting thing about our program is mentor groups. So I don't know exactly how long, ever since I've been in the program has divided up us into 4 different mentor groups, where everyone is going to have someone of the PGY level. So you have an intern, 2, 3, 4. And this has been really great for our program because you have somebody who you can work on some of these scholarly activities and QI projects, and work together with someone who's done it multiple times above you, and then also have the opportunity to mentor someone below you throughout your residency. So this is super helpful. Like if you don't know who to ask on how to write this paper, or where do I look to find a paper, you just have a built-in mentor group. And we meet with these people with the mentor groups once a month. You go over any issues, and you help each other. And these groups are also how we divide some of our didactics, like our journal clubs, M&M conferences, case reviews, our anatomy blocks, other things like that. And each mentor group has a faculty member. They have a senior faculty and a junior faculty on each of these mentor groups. So like my group has Dr. Kaiser, who's been practicing since the 90s, and then Dr. Hunton, who is a new attending, I think this is her 4th year. So you have a lot of faculty support that are also at these meetings. Something else I think that's great about these mentor groups is for resident wellness. It can be difficult to talk about you struggling with a particular rotation or anything regarding your life. So, when you move to this new town, you don't really know anyone. Well, you're automatically put with someone who is actively trying to make sure you're okay and make sure you're prepared for these rotations. So I think mentor groups are a great addition to our residency.
5 minutes.
All right. So Arkansas is known as the natural state. Our minor league baseball team is the Naturals. That's what they're all about. And it really is the natural state. There are tons of, smaller mountains, climbable mountains, even for me. And there's lots of water. So there's lots of lakes, little waterfalls. Basically, everywhere you go, there's a little place you can hike or take a trip to. So these are some of our residents enjoying some of the scenes. This is us a couple years ago at a float trip. We're actually having one in a couple weeks. So, we like to really enjoy the outdoors here. Some more photos. Here's Dr. Means playing some cornhole. Here's me on the lake. And, we really like to have fun together. So here's just some random pictures of us at various events, hanging out, conferences, whatever it may be. Dr. Means is a leprechaun. It's always interesting. So one of the things I wanted to take a couple of seconds about, just going to take 1 second, is we want to do some PM&R chats this year. So I went to medical school at William Carey in Hattiesburg, Mississippi, and I did not have a home program. And so when I did an away rotation here, Dr. Gardner really walked me through a lot of the application and all the things to expect, and it was super helpful. And so we wanted to offer that for other applicants, whether you have a home program or not. Dr. Gardner just wanted to walk you through kind of the things that she thinks are helpful for an ERAS application. And then later on, we're going to do a Zoom with some of our residents and answer any questions. That's just something I thought was really, really great. So I'm going to put in a little Google form if anyone wants to sign up for that. And we'll be posting all of this stuff on our socials later. Oh, yes, that's a good point, Emery. I saw that in the chat. So I wanted to put a map in here. I apologize. But all of these sites that I mentioned, UAMS, the VA, Children's, Baptist, they are all the furthest you will ever be from any of your sites is 15 minutes. If you're going from UAMS to the VA, it is literally the same parking lot. So all of our hospitals are right next to each other, and you never have to drive further than 15 minutes. All right, does anyone have any questions or anything they'd like to talk about? We've got at least a couple residents in here that can also assist. While I'm waiting on questions, one of the things I heard in the last session that a question some people had was community outreach. So something we do is with children's, we have Miracle League, which is adaptive sports for kids. And then in Bryant, there's an adaptive sports facility where you can volunteer if you'd like. And then we also have Camp Aldersgate, which is a camp for people with special needs, so that way they can still go to summer camp, and that's a volunteer activity that's available as well. We got a question that says, what upcoming changes to the program are you excited about? So anyone can jump in. I'm personally excited for the opportunity for our program to get a new chair and some new faculty in here. When I joined, we had a lot of people that had been here for a long time, and we're getting a lot of new faculty, and it's really, really great to see the kind of the fresh energy and the fresh takes that they have. And so I think that's great for the program to continue growing.
Yeah, I'll second that. Hey guys, I'm Neil Simmons. I'm a PGY2. I was a little late to the meeting. Zoom was not cooperative, but yeah, I'm absolutely thrilled to get some new faculty. Some younger faces in the program is always interesting. Our field changes so much with especially new procedures and new techniques that are being invented, and it's just really interesting to have new blood in the program. So I think that's something that everyone is very excited about. And the old faculty are all exceptional, like big pillars of PM&R, but it's just nice to have new blood always. So very excited about that.
All right, fantastic. So that wraps up this part of the program. If there are any more questions, you can throw them into the chat or reach out to faculty and residents